Numbness and tingling are two of the most common symptoms people experience, and two of the most commonly misunderstood. Most people chalk it up to sleeping in a weird position or sitting too long, and sometimes that's exactly what it is. But other times, your body is signaling something much more specific, and it's worth understanding the difference. Your nervous system is the communication network between your brain and every part of your body. When that network is working properly, you feel sensation normally: pressure, temperature, touch. When something disrupts that system, whether it's compression, damage, or disease, the signals get distorted. That distortion is what you feel as numbness, tingling, burning, or that familiar pins and needles sensation. The first thing to understand is that these sensations are symptoms, not diagnoses. Numbness and tingling by themselves don't tell you much. What matters is where they occur, how long they last, what else accompanies them, and whether they come and go or stay put. Let's start with the most common reason, and the one that's almost never a problem. When you sit with your legs crossed for a while or fall asleep with your arm folded under you, you're putting direct pressure on a nerve. That cuts off the electrical signal traveling along that nerve. You wake up and your hand feels dead, or your foot is buzzing. Move around, let the pressure release, and within a minute or two, sensation comes back. That's not a medical concern. That's just your nerve telling you to change position. But when tingling shows up without any obvious mechanical cause, or keeps returning in the same place, or starts moving, that's a different conversation. One of the most frequent causes of persistent tingling is a condition called peripheral neuropathy. This is when the nerves outside of your brain and spinal cord, the peripheral nerves, begin to malfunction. The most common cause in the United States is uncontrolled or poorly controlled diabetes. High blood sugar, over time, damages the small blood vessels that supply oxygen and nutrients to your nerves. Without that supply, the nerves slowly deteriorate. The tingling usually starts in the feet, often described as a burning, buzzing, or walking on sand feeling, and gradually moves upward. Some people also notice their feet feel numb rather than tingly, which can actually be more dangerous because it means the sensation loss is more advanced. A small cut or sore can go unnoticed, which is why diabetic foot complications are so serious. If you have diabetes and you're experiencing any numbness or tingling in your feet or legs, that conversation needs to happen with your doctor. It doesn't mean something catastrophic is happening, but it does mean your blood sugar management needs closer attention. Vitamin B12 deficiency is another cause that often gets missed. B12 is essential for maintaining the protective coating around your nerves, a layer called myelin. Think of myelin like the insulation around an electrical wire. When it thins out or breaks down, the signal becomes erratic. You get tingling, numbness, sometimes a strange weakness. The tricky thing about B12 deficiency is that it can develop very slowly, over years, and people often blame the symptoms on aging or stress before the real cause is identified. Those most at risk include vegetarians and vegans, because B12 is found almost exclusively in animal products. Older adults also absorb it less efficiently, and people who take a medication called metformin for diabetes or proton pump inhibitors for acid reflux. Medications like omeprazole can develop B12 depletion over time. If you fall into any of those categories and you've been experiencing tingling in your hands or feet, a simple blood test can confirm whether B12 is the issue. Now let's talk about the spine. Your spinal cord and the nerves that branch from it are the main pathways carrying sensation to your limbs. When one of those pathways gets compressed by a herniated disc, a bone spur, or narrowing of the spinal canal, you can get tingling that radiates out along the nerve's path. If it's in the lower back, you might feel it running down one leg, sometimes all the way to the foot. This is sciatica. If it's in the neck, the tingling might travel down the arm into specific fingers. Which fingers are affected can actually help a doctor identify exactly which nerve is involved. Compression at C6, for example, tends to affect the thumb and index finger. Compression at C7 more often affects the middle finger. Carpal tunnel syndrome falls into a similar category, not a spine problem, but nerve compression in the wrist. The median nerve passes through a narrow channel in your wrist called the carpal tunnel. When that space narrows due to repetitive motion, inflammation, or fluid retention, the nerve gets squeezed. The classic pattern is tingling and numbness in the thumb, index, middle, and part of the ring finger, especially at night or when you're holding something like a phone or steering wheel for a period of time. Multiple sclerosis is something people worry about when they look up tingling online, and it's worth addressing directly. MS is a condition where the immune system mistakenly attacks myelin in the central nervous system. Tingling and numbness are indeed among its symptoms, but they're almost always accompanied by other signs. Visual disturbances, unusual fatigue, balance problems, weakness on one side of the body. A single episode of tingling in your feet almost certainly isn't MS, but if you're experiencing tingling alongside neurological symptoms in different parts of your body at different times, and you're young, that warrants evaluation. One more cause that deserves attention: circulation problems. When blood flow to a limb is reduced, as can happen in peripheral arterial disease, especially in people who smoke or have high blood pressure, you can experience tingling, coldness, or numbness, usually in the feet and legs. Poor circulation and poor nerve health often go together. Both can be caused by the same underlying risk factors. Now, here's what actually warrants urgent attention. If you experience sudden numbness or weakness on one side of your face, one arm, or one leg, especially if it comes on abruptly and without warning, that is a possible stroke, and it's a medical emergency. Other warning signs of stroke include sudden confusion, sudden trouble speaking or understanding speech, sudden vision problems, or a severe headache unlike any you've had before. These symptoms demand immediate action. Don't wait to see if they improve. Similarly, if tingling comes on after a neck or back injury, or if it's accompanied by loss of bladder or bowel control, seek emergency care. For most people, the tingling you experience is not a crisis, but it is information. Persistent tingling that keeps coming back, or numbness that doesn't resolve within a few minutes, or symptoms that are spreading. These are reasons to see your doctor and have some straightforward tests done. A metabolic panel can check your blood sugar and kidney function. A B12 level is a simple add-on. If nerve damage is suspected, a nerve conduction study can assess how well your nerves are transmitting signals. From a lifestyle standpoint, the most impactful things you can do are also the least complicated. Keeping blood sugar controlled, whether or not you're diabetic, reduces nerve inflammation. Regular movement improves both circulation and nerve health. Avoiding prolonged pressure on nerves by changing positions frequently matters more than people realize. Limiting alcohol, which is directly toxic to peripheral nerves, makes a real difference. And if you're on long-term medications, it's worth asking your pharmacist or physician whether any of them are known to affect B12 or nerve function. Tingling is your nervous system asking for attention. Most of the time, the conversation is short and the answer is simple. Occasionally, it's a window into something that needs care. Knowing the difference isn't something you have to figure out alone, but being informed enough to ask the right questions is genuinely useful. If what you've heard today sounds like something you've been experiencing, the most worthwhile first step is a conversation with your doctor and a basic blood panel. It's rarely complicated to begin with and almost always manageable when caught early. And there you have it. Take this knowledge and take control of your health. Thank you for watching.